Hi everyone. In this video we are going to talk about 8 common study mistakes that people make when preparing for the NCLEX. If you're new here, welcome. I am an RN with a BSN. I graduated from nursing school in May of 2011, and ever since then I have dedicated my time to helping other nursing students earn a 90 percentile score on the NCLEX. So let's jump into the video. The first mistake is only reading notes or only watching videos. A lot of people get caught up in the simplicity of just watching a YouTube video or reading notes. And although these are great resources, they're not as effective if you're not also doing questions. You need to do a ton of practice questions. So make sure you're balancing your review of material with practice questions. The second mistake is not practicing enough questions. Like I just said, you need to be doing a ton of practice questions. Most people aim for around 75 questions, and I recommend doing all of the questions that you can within reason. It is better to space them out over a longer period of time than to cram a bunch of questions all at once. The third mistake is skipping rationales. Skipping rationales is a big mistake because the rationales often have important information that can help you understand why the correct answer is the correct answer and why the incorrect answers are incorrect. A lot of times they'll even tell you the concept that you should think of or the guideline that you should follow. So make sure you're never skipping the rationales. The fourth mistake is going into the NCLEX without a strategy for priority questions. So one of the things that makes the NCLEX different from other nursing exams is that it has these priority questions. They can be identified through the stem or the question of the question, and they can also be identified through the answer choices. So you want to look out for keywords that indicate that it's a priority question. And there are multiple ways to prioritize these answers. I personally like to use the ABCD method, and I talk about that in this video right here, but you can also use other strategies such as focusing on safety or Maslow's hierarchy of needs. The fifth mistake is having an inconsistent study schedule. Studying for the NCLEX can take anywhere between a couple of weeks to a couple of months depending on how much time you have and how well you know the material. But whatever amount of time you need, make sure you're dedicating a consistent amount of time each day to studying. It's better to study for 1 hour each day than to cram for 10 hours straight. The sixth mistake is not practicing next-gen NCLEX case studies. So the next-gen NCLEX is a little bit different from the traditional NCLEX. It has these case studies and they can be identified by this icon. These questions are so different that they really can't be prepared for by just doing regular practice questions. So make sure you're going onto UWorld and practicing those next-gen case studies. The seventh mistake is memorizing facts and figures instead of understanding them. So for example, if you're reviewing medication names and dosages, don't just memorize the medication and the dosage. Also try to understand why the provider might prescribe that medication and what side effects to look out for. The more that you understand the material, the easier it will be to apply that knowledge to a question that you've never seen before. The eighth mistake is ignoring weak areas. So one of the great things about studying for the NCLEX is that you can actually identify your weak areas and focus on those weak areas. So for example, if you're getting a lot of medical surgical questions wrong, then you probably need to review some medical surgical nursing. I recommend using the Saunders book as a resource to review your weak areas. If you found this video helpful, please give it a thumbs up and share it with a friend. If you're interested in more NCLEX study tips, check out this playlist. Thank you so much for watching, and I hope you have a great day.